I am Preeti, second year MBBS student from Hassan Institute of Medical Science. In this video, I'll be teaching about the kidney, which is an important question for a 10-mark question, long essay question. It has been asked in a previous year, reverse syllabus 2 and 3. The sub-questions asked under these question will be location of kidney, where it is located, size of the kidney, the borders of the kidney and surfaces of the kidney, coverings of the kidney, and relation of kidney with other structures, blood supply, development, congenital anomaly during the development, the abnormalities, and applied aspect of kidney and microscopic structure. These are the sub questions asked under kidney. I'll try to teach you simplified way and throw the diagrams I'm teaching so that you remember more, for a long time. And then if you see only, I always think that if you see, you'll remember for a long time, and then reading these sentences and paragraphs. In this video, first I'll be teaching you about all the diagrams and then making you understand and try to remember and recall in a quicker manner. This is a abdomen. Abdomen is divided into 9 quadrants. This quadrant is actually 1/4, but here why they call a quadrant I don't know exactly. This is a transpyloric plane. Where transpyloric plane it passes exactly on the tip of the 9th costal cartilage, and this is a transtubercular plane. Transtubercular plane will be. Now we come for the first sub-question. First sub-question will be the location of the kidney, where it is located. If we have to divide this abdomen into 9 quadrants, we divide through the mid-clavicular line. These two are mid-clavicular line, and this is a transpyloric plane which is passing at the tip of the 9th costal cartilage. This is a transpyloric plane, this is a mid-clavicular line, this is other mid-clavicular line on the other side, and this is a transtubercular plane which passes on the tubercle of the hip bone, and it is divided into 9 quadrants. This will be the umbilicus. Above the umbilicus is the epi means above, below means hypo. This is the epigastrium region. This is hypogastrium region. Below the stomach, gastrium is the stomach, and this is a right side and this is a left side. So right iliac fossa, this is a left iliac fossa, and this is a right hypochondrium, and this is a left hypochondrium. These are the 9 quadrants of the abdomen. Thus the kidney is located in the upper 6 quadrant. You can see upper 6 quadrant. The kidney is located. Kidney is located in the upper 6 quadrant. It is tilted slightly medially. The upper pole is tilted slightly medially and lower pole is tilted slightly laterally. This is the location of the kidney which we have to write. And the introduction, you can write the points as a bean shaped and reddish brown color. It is located in the posterior abdominal wall. These are the introduction point, right? You can write, and this is the position of the kidney, and with respect to the vertebra you can write. Because of the liver, presence of liver on the right side, this is the right side, there will be liver here. So the right kidney will be slightly lower than the left kidney. Left kidney will be at the position from T12 to L2 vertebra, whereas right kidney will be from L1 to L3 vertebra. Because of the presence of the liver, right kidney is slightly lower than the left kidney. And this diagram and this diagram also you can write. If you write the more diagrams in a theory exams, you will conquer more marks. So try focusing writing diagrams, practicing diagrams, and remembering those diagrams. If you remember the diagrams, it is so easy to write you those theory points. So I mainly focus on the diagrams. And these 2 diagrams you can write, and other location is over. You understood that these 6 quadrants the kidneys are present, and tilted upper pole is tilted slightly medially and lower pole away from this thing. And these are bean shaped, and T12 to L3 total, and left will be slightly upper than this, so T12 to L2, whereas the right will be L1 to L3. And other diagram will be this diagram depicts the distance from the midline, that is 2.5. Upper pole will be 2.5 centimeter, and hilum will be 5 centimeter away from the this lateral border of the vertebra, and this will be 7.5 centimeter. Lower pole will be 7.5 centimeter away from the lateral border of the vertebra. You can remember as 2.5. If you double 5, again add 2.5, add 2.5, will get 7.5. This is the thing. Medial, it will be exactly like this. this oblique line, it will be tilted, and the right kidney will be slightly lower than the left kidney, so it occupies L1, L2 and L3. This is the other diagram. If you can write, if possible you can write, right? And the dimensions you can remember through this. The breadth of this is 6 and thickness will be 3, so you multiply, like in double it. First 3, 6 and 12. 3 double 6, 6 double 12. So thickness is 3 centimeter, whereas the length will be 6 centimeter. Length will be 12 centimeter. Breadth will be 6 centimeter. Breadth will be smaller. Thickness is very smaller. Breadth, after that length 3, 6 and 12. 12 you make it as 11, so it becomes. And this will be medial side towards this vertebral column. This is a medial border and this is a lateral border. From medial border, this is a concave, and in between some depression will be the convex. Here, from here, the ureter comes out. From renal pelvis, ureter comes out from the medial border. At the center, this is hilum. This is the anterior surface, and the upper one will be the back side will be the posterior surface. This is the upper pole and this is the lower pole. The 4 diagrams I have made you understand. You can write these 4 diagrams. This depicts the external features, that is a number of folds and then the borders and everything. Now other diagram will be this will be the relationship of the structures that is passing in the hilum. This is a hilum, how it passes. First vein, then artery, then the renal pelvis. That continues as a ureter. You usually remember as VAN, no? In place of nerve, you take as pelvis, VAP. Vein, renal artery, and the renal pelvis. This is the order from anterior to the posterior. Right kidney, convex, and this is a convex. From there pelvis will come out. Renal pelvis will come out, that continues as ureter. And posterior relations, you have to remember this also. This is the most important question for 3 marks also, and separately they ask for 3 mark question, and also in 10 mark question they ask as a sub question. This is a right kidney and this is a left kidney. Right kidney you see mainly liver, no? Liver superimposes on this. Largest area is covered by the hepatic area. Liver will be in the right side, so this large portion of this is covered by the hepatic area. Above both of this suprarenal gland, above the kidney, suprarenal gland will be there. So above both semilunar shape, it is occupied by the suprarenal gland. And what else will be there in the right side? Right side we will be having duodenum. C-shaped this superimposition will be for the duodenum. And this is a colic area. Colic area will be present in both the right and left colic flexures will be there. So this is a colic area. Jejunum is also present in both, but jejunum on the right side will be lesser. It occupies lesser. Here it occupies more larger area. And then what else will be there in the left side? Left side you can see a stomach. This is the gastric area. Above the stomach you see spleen. This is the splenic area. And this is the pancreas. Pancreas will go, the tail of pancreas goes and attaches to the spleen. No? So this is a splenic area. And this is jejunum. Jejunum here it occupies less area, whereas here it occupies more area. And this is a colic flexure. Both the sides are there. These are the relations you have to write for the posterior surface on the right side. Right side is also important, and left side the posterior relation is also important for the 3 mark question. So you need to remember this. And this is the anterior structure. Sorry, these are the anterior structures. You need to remember those three. The kidneys will be present posterior. No, all these structures will be present anterior. So these are the anterior structures, and posterior structures also. Posterior structures of both the kidneys will be similar, mostly similar, because it all ribs. Only in case of ribs it will be different, because left kidney will be slightly lower than the right kidney. So the ribs on the left side will be only 12th rib, it will be related to only 12th rib, whereas left kidney will be slightly more, so it is related to both 11th rib and 12th rib. These are the posterior relations of the kidney. We have to remember this, and right. There will be 2 ribs relating to the left kidney, as it is slightly above from the right kidney. So 11th rib and 12th rib are related to left kidney, and this is a median cruciate ligament, and this is a lateral cruciate ligament. Median side median cruciate ligament, lateral side lateral cruciate ligament. From there, VAN structures will be passing. V, A, and N. This is a subcostal vein, subcostal artery. Subcostal means below the costal. Anything below below this rib we call as a subcostal artery, subcostal nerve, and this is the 12th thoracic nerve is a subcostal nerve, and this is a T12 nerve. The 12th coastal 12th spinal nerve is known as a subcostal nerve, and this is a subcostal nerve, VAN structures. This is a median arcuate ligament. Arcuate means arch shape. This is a lateral arcuate ligament, and four muscles will be related. This is medial side. Median side is a psoas major, quadratus lumborum. Lumborum is straight, erected. Quadratus lumborum muscle, and this is a transverse abdominis muscle, one of the muscle of the abdomen, that is external oblique, internal oblique. Inside that there will be transverse abdomen. This is a abdomen, transverse abdomen is related to the kidney. So psoas major, quadratus lumborum, and transverse abdomen, and above this will be here median arcuate ligament, lateral arcuate ligament, where there will be the diaphragm. This is related to the diaphragm. These are the posterior relations of the kidney, whereas in right kidney only one rib is related, that is 12th rib, as this is slightly lower than the left kidney. These are the posterior relations of kidney, and now we will see the capsules and coverings of the kidney. Capsules and covering of this is kidney. We can see this is a vertical section, and this is a cross section. This is a horizontal section. We can see vertical section. First we will discuss. Here the externally there will be skin, and here are the ribs. These are the ribs. In between the ribs we have external intercostal muscles and internal intercostal muscles. This is a pleural cavity, parietal pleura and visceral pleura. Then there will be lungs. This is a diaphragm. Below the lungs there will be a diaphragm. After that, this is abdominal space. From iliac crest to the 12th rib there is a rectus abdominis muscle and piriformis muscle here, and then below the 12th rib there will be three VAN structures. There is subcostal vein, subcostal artery, and subcostal nerve. This is a VAN structure, and this the heliohypogastric nerve and helioinguinal nerve. To these two structures also related. These two structures also have the same root value, and so they will be always together. And after that, quadratus lumborum muscle will be there. I told that in the posterior relations of the kidney. And this is the iliac crest. This is a kidney. If we take this as a kidney, this is covered by the capsule. That is a kidney we guess renal term we use. Renal capsule. Covering the kidney, renal capsule. After the renal capsule, peri means surrounding. Perinephric. Nephric means the cells, each cells in the kidney is called as a nephron. So perinephric fat is surrounding the renal capsule. After that, renal fascia. Fascia covering the kidney is a renal fascia. After that, paranephric. Para means beside. Peri means surrounding, para means beside. So paranephric fat is outside this thing. Above the kidney there is a gland called suprarenal gland. Supra means above, renal means kidney. Suprarenal gland will be there. Covering that is a fascia. This fascia comes, blunts, and then again covers the suprarenal gland, and then it blunts with the diaphragmatic fascia below the diaphragm. The fascia below the diaphragm is a diaphragmatic fascia. This is a covering of the kidney. You can write on your own words, like if you understand this this thing. And if you see the transverse section where near the any vertebra the kidney appears. This is a kidney, vein-shaped kidney. This is a medial surface that is cut like this, and the fascia covering is a renal fascia. The renal artery and vein is coming. This is an anterior side. I said VAP. You can remember vein, artery, and renal pelvis. So vein, you can write vein. It drains into the inferior vena cava, and artery. It is a renal artery is a branch of abdominal aorta. So it comes artery, and this is a vertebra. Medial side psoas major I told, and the lateral side quadratus lumborum will be there, and this is a fascia transversalis. This is a fascia transversalis, which is below the transverse abdominis muscle, and this is a true capsule covering the kidney. This is a true capsule, and this is a peritoneum. This is the transverse section of the kidney. And if there is an absence of peripheral fat, there is a kicking of ureter. But there is if there is a peripheral fat enclosing the kidney, there will be. If there is no peripheral fat in this, because of the weight, the structure is preserved like this. Because of the weight that comes down, the kidney comes down. So this is known as kicking of ureter. We call this condition is known as kicking of ureter. See, you can see the cockroach like shape it is. And the other thing will be microscopic structure of kidney. Microscopic structure, you can see this is our renal pyramids. This is a kidney, and these are the columns where there will be collecting duct, and these are minor calyx, and that opens into major calyx that will be open into the renal pelvis, which we continue as ureter. And here renal pyramids opens into the minor calyx. From minor calyx, many minor calyx and joins to form major calyx. Major calyx into renal pelvis and which continues as ureter. This is the capsule, renal pyramids, renal cortex and medulla, renal columns. These are medullary rays. Rays means they going like rays. Minor calyx, major calyx, renal pelvis, and this is a ureter. And the other diagram will be these structures showing the proper kidney and sinus. This is the sinus, this is the sinus, and this is a kidney proper. Renal capsule covering the kidney and renal cortex, and this is a medulla. This is a kidney proper, including cortex, medulla, and capsule. This is a renal sinus, which is the space near the hilum. I have discussed so many images. If you draw these images, just you can explain on your own words, you'll get you can score so much good marks out of 10. And this is a how the urine is filtered and then formed. Uriniferous tubules. This is each structure of the kidney. That is, nephron is a structural and functional unit of the kidney. This is a nephron. This is a nephron. This is a Bowman's capsule, and this is a afferent, and this is efferent. This is efferent and this is afferent. This is a glomerular where filtration takes place and GFR is formed, and then this is a proximal convoluted. Proximal is near to this. Proximal convoluted. This is distal away from this. Proximal, the convoluted tubule, and this is a descending loop of Henle. This is a loop of Henle. This is the descending limb, ascending limb. This is a distal convoluted tubule, and it opens into the collecting duct. Many nephrons opens into the collecting duct. This is a cortex. Cortex region we will see glomerulus, and this is a this depth will be in the loop of Henle will be in the medullary region, and then it opens into the minor calyx, major calyx. This is the renal papillae, open papillae, small this projection type, open into minor calyx, major calyx. This is the cortex, this is the medulla, renal sinus. Then this all you understood, I think. Then open into the renal pelvis, open into the ureter, and where it enters into the urinary bladder. This is a uriniferous tubule structure, and the arterial supply of kidney we can speak of. The kidney arterial supply gets from the abdominal aorta. Abdominal aorta as renal artery, right renal artery, left renal artery, right renal artery and left renal artery again further divided into anterior division and posterior division. Anterior division supplies these segments. You can see here renal artery enters the kidney and forms a lobar artery. Each lobe is supplied by the lobar artery. In between the two lobe, inter means in between two lobe, interlobar artery, and forms arcuate. Arcuate means heart shape. Arcuate artery that finally forms interlobular artery. Interlobar artery. After that, interlobular artery. These kidney renal arteries further divided into, as I told, anterior branch and posterior branch. Renal artery is divided into anterior branch and posterior branch. Anterior branch provide blood supply to apical region, upper, middle, and lower region. Upper, lower, middle, and apical most this thing that structure. And posterior segment is supplied by these are vascular segment. If they ask you about the vascular segment for the 3 marks, you have to write this. Posterior segment is supplied by the posterior branch of renal artery, and this is a broad line which separates anterior division and anterior segment and posterior segment. This is a avascular plane which separates anterior and posterior segment. And anomalies will be anomalies means during the development it can form horseshoe shaped kidney where the lower poles of the kidney it fuses to in the anterior region and forms isthmus. This limits the ascent of kidney. Kidney is formed in the pelvic region. It has to ascend into the lumbar region. So, ascent of kidney is prevented by forming by fusion of lower poles of the kidney. It prevents the ascent of kidney. And this is a polycystic. Kidney condition where you can see that there is a luminal continuity between the nephrons. During the development of the nephrons, as you already studied, there will be 2 parts. This is a filtrate part and then this is collecting part. Those two do not fuses. This results in a polycystic kidney. And one more condition will be calculi. Renal calculi this is another clinical correlation. You can write as a renal calculi. And the development part I'll teach you in other video. This is a Morris parallelogram. Morris parallelogram, they'll be asking for you to surface mark the Morris parallelogram. You can you know the scapula. Scapula will be 2 to 7th position, the 7th thoracic vertebra. From the if you lower angle of the scapula will coincide with the 7th thoracic vertebra. From there you can count 7, 8, 9, 10, 11, T11. At T11 you draw one line, and at L3 you draw one line, and this will be 2.5 centimeter and 9 centimeter away from that. You draw one line. This represent the Morris parallelogram, and you draw the kidney slightly tilted low. Upper pole will be slightly tilted toward the midline. This represent the surface marking of the kidney. If you find this video is helpful, please do like, share, and subscribe to my channel, and appreciate me for making more videos. Thank you.